Over the past few days, we have come across some strange and terrifying incidents. The subject is a heart attack. Sometimes I get news now that someone young man died of a heart attack. For example, famous Indian singer KK, Kannada South Indian movie superstar Punit Rajkumar, etc. The biggest question is, why is this problem among young people? But if you Google it, you will find that Indians get heart disease 8 to 10 years earlier than other countries. Here is the question, why is it seen so quickly? Research has shown that genetic problems are at the root of this problem, and we know this gene as CHGA promoter haplotype. The effect of this gene is more common in Indians. But why is the problem of heart attack increasing among young people? We have identified few reasons behind it. By looking at these, we can avoid this problem at an early age. Number 1. Heart attacks in young adults are often caused by underlying health conditions. Heart attacks in young adults are often caused by underlying health conditions. These health conditions can include high blood pressure, high cholesterol, diabetes, smoking, and drinking alcohol. If you have any of these risk factors, it is important to talk to your doctor about ways to reduce your risk. Number 2. Heart attacks can also be caused by lifestyle choices such as smoking or eating an unhealthy diet. Heart attacks can also be caused by lifestyle choices such as smoking, drinking alcohol, and eating an unhealthy diet. We do not comply with the amount of protein, carbohydrates, micronutrients that we need in food. These choices can lead to plaque buildup in the arteries, which can eventually rupture and cause a heart attack. It is very important to consult a doctor in this regard. Besides, now processed food is very cheap. People are more inclined towards it. You can check what processed food is by Google. It also creates more physical problems. Besides, research says that 1 in 4 people die because of smoking and drinking. Therefore, it is important to live a healthy lifestyle in order to reduce your risk of having a heart attack. Number 3. Stress can also be a factor in triggering a heart attack. Stress can also be a factor in triggering a heart attack. The American Heart Association reports that stress is a contributing factor in the development of cardiovascular disease and can also trigger a heart attack. While the exact mechanisms are not fully understood, it is believed that stress can cause changes in the autonomic nervous system, which controls the heart rate and blood pressure. It is also thought to increase the levels of hormones such as adrenaline and cortisol, which can also contribute to heart problems. Besides, research shows that those who have more heart problems work in very stressful places. As an example, I can talk about the IT sector. Also, various companies have jobs to meet targets, which have a very bad effect on the body. Apart from these, the financial situation of the family, the fear of losing the job, these things are working in the mind of someone. 88% of Indians feel that a lot of stress comes from their profession in their daily life. Before telling rest of the points, I can tell you one thing, some tricks help us keep our body healthy in our daily life. One such home doctor product link is given in the description. You can see that. Number 4. Lack of sleep can also increase the heart attack problem. Excessive stress can also affect our sleep very badly, and lack of sleep can also increase the heart attack problem. When you don't get enough sleep, your body does not have time to rest and repair itself. These can lead to an increased heart rate, blood pressure, and cholesterol, which can put you at risk for a heart attack. Doctors say that a person needs 7 to 8 hours of sleep every day. Number 5. Lack of exercise can also increase the heart problem. Lack of exercise can also increase the heart problem. It can also lead to high blood pressure and other health problems. According to doctor, we need to sweat at least 30 minutes every day. A research shows that 33% of young Indians say that they do not have time to exercise due to work pressure. This is very unfortunate. Even if we work very hard for 30 minutes, our body will sweat. Number 6. Family history can play a role in increasing the risk of a heart attack. There is no one definitive cause of heart attacks, but family history can play a role in increasing the risk. If someone in your immediate family has had a heart attack, your risk is increased. Other factors such as high blood pressure, high cholesterol, diabetes, and smoking can also contribute to the development of heart disease. The best way to reduce your risk of a heart attack is to live a healthy lifestyle, including eating a healthy diet, maintaining a healthy weight, and getting regular exercise. If you have a family history of heart disease, you should talk to your doctor about ways to reduce your risk. Indians have a bit of gene problem, so even if we can't get rid of this heart attack problem permanently, but we can organize our life properly, then we can solve many of these problems. But if there is a heart problem, some symptoms are seen in our body. For example, excessive sweating with little tension, chest pain, pain in the jawline of the face. If you see any such problem in the body, then consult your doctor at your own time. Thank you.